There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
Dangerous F hypertension, R high blood pressure, RWLL known. The UMHVN signs or symptoms, T so-called silent killer and B wreaking havoc in our body, damaging our arteries and detaxing our heart. THRRMHNGUULD make T or lifestyle T reduce high blood pressure. SMFTH will lower our blood pressure in a matter of weeks. Will THRMTK longer? TH include cutting our salt intake TLTHN 6 grams, 0.0 a day. Find HWN reduce TH amount of salt in our diet. Eating a low-fat, balanced diet including plenty of fresh fruit and vegetables. GT tips and eating Mr. Healthily. Being active road M tips but ding Mr. Exercise. Cutting DWN and alcohol GT tips and cutting down, including downloading a drinks diary and keeping track of her drinking. Losing weight. Find WHD or ideal weight using THBMI healthy weight calculator. ND road advice but losing weight if you're overweight. Drinking L caffeine found in coffee, tea and cola. Stopping smoking GTHL quitting. Ding TLT 9 hours F sleep a night if UN road M tips FR ding T sleep. SBRL medications NBA THL control high blood pressure. MN people NDTTK a combination F different medicines. TH medication recommended FRUT for will depend on your age and ethnicity. If you're under 55 years of age you'll be offered an ACE inhibitor or an angiotensin II receptor blocker. ARB if you're aged 55 or older, or you're an HNDF African or Caribbean origin you'll be offered a calcium channel blocker. UMNDTTK blood pressure medication FRTH rest for life. But doctor might BBLT reduce or stop treatment if blood pressure stays under control FRVRL years. High blood pressure usually is present for years before its complications develop. Ideally, hypertension is treated early before it damages critical organs in the body. A wonderful therapy to control high blood pressure given it control your blood pressure has helped many patients to get rid of this disease and lead a healthy life. I will answer this as simply as possible for anyone to understand. This is just a suggestion. Go to nutritionfacts.org. The latest in nutrition-related research and educate yourself about healthy eating and habits and food to avoid. He came out with an app called something like Drive. Gregor's Daily Dozen. Download it and see if you can eat only the foods on the list. It's different, difficult, but not impossible. He also has a TED Talk that recently came out. Look for it and watch it. Reflect upon your own diet. Buy a Moleskine journal or notepad and jot down everything you eat for 2 weeks. Compare your foods you wrote down in your journal to the foods on the Drive. Gregor's app. Replace and change what doesn't match his food on his app. Get the appropriate amount of exercise. Compare your blood pressure from day 1 to day 14 and record results. Buy his cookbook and his regular book too. How Not to Die by Michael Greger. Keep these books for the rest of your life and pass them on to kids or relatives. Lifestyle changes are best. Keep a healthy weight. Stay physically active and do some sort of cardio for 20 minutes a day in the target beats per minute for your age if possible. Keep sodium intake to 2 grams a day or less. Avoid processed foods. Eat according to my plate guidelines. And quit smoking. Having said that, sometimes blood pressure can be stubborn and will not respond to even the best lifestyle changes. Then it's time to medicate. Exactly what med will be determined by a physician, but there really isn't one that stands out as much better than the rest. Lifestyle changes are best. Keep a healthy weight. Stay physically active and do some sort of cardio for 20 minutes a day in the target beats per minute for your age if possible. Keep sodium intake to 2 grams a day or less. Avoid processed foods. Eat according to my plate guidelines. And quit smoking. Having said that, sometimes blood pressure can be stubborn and will not respond to even the best lifestyle changes. Then it's time to medicate. Exactly what med will be determined by a physician, but there really isn't one that stands out as much better than the rest.